let's try and understand what really is happening with the hospital segment right now and the healthcare industry overall, whether there are margin and revenue levers in place. Let me welcome on board Sandhya J, the Group CFO at Narayana Healthcare, joining in on the show right now to talk more about what's really happening with this particular company. Sandhya, hi, morning. Before I come to business, a quick word on the industry, because a lot of market participants and brokerages are highlighting concerns on rising cases of hospital insurer conflicts during the contract renewal, and there are instances as well of hospitals warning about suspending the cashless facilities of health insurers. Tell us exactly what's happening on the ground situation right now, and what kind of impact does it have on your business?
Good morning. Thank you for having me here. So the insurance contracts are typically negotiated for a period of 2 years. And these contracts work both in terms of the price at which the service is offered and also in terms of some of the facilities that we want to make available to the patients. Now, we have very healthy relationship with most of our insurance partners, and we have not seen any conflict. Now, the challenge with insurance is that the cost of healthcare is going up. That's a fact because the underlying costs are going up. We've always spoken, a lot of the input material and equipments are imported. So there is a challenge there. So therefore, I think some of the conflict is stemming from the fact that for the insurance companies, there is a certain affordability, and for hospitals, there is a recovery expectation. And sometimes that has to align. For us, because we are a affordable healthcare brand, and therefore, in terms of our for the quality of the services that we offer, I think our prices come in at the more mass market level, and so we kind of crack that balance of high quality and affordable prices. So we kind of are able to manage our relationships with our insurance partners reasonably well. I think the more transparency and digitization that comes into the system, this relationship will strengthen further.
Tell us about your insurance product, Aditi, and how different is it from the normal health insurance product?
The way we have looked at Aditi is that it is affordable insurance. We are targeting people who do not have the ability to afford an insurance today. So it's placed in terms of that from a pricing point of view. From a service point of view, we are ensuring that we work with the customers in the journey. So we are starting with a very strong preventive mechanism where we are giving people insights into their health as soon as they enroll on the policy. So we know what we need to work together on in terms of health outcomes. And when people come in, if at all, at some point in time there is a health event, then we are trying to make it as seamless and as holistic as possible from a care point of view. So we have a 1 crore limit for surgeries, and we have about 5 lakh kind of limit for medical management. And the premium is average is about 10,000, but it varies depending on age and other risk factors. But on an average basis, it's about 10,000. So we believe that somebody who hasn't aspired for a medical insurance before can now avail medical services with dignity.
Point taken, but just around Aditi, a further question, because we understand right now it's limited to just the Narayana facilities. Is there a plan to kind of extend it, and how exactly are you going to do that?
So it is limited to Narayana for electives. For emergency, it is open to all hospitals. At the moment, we are working with at our facility only kind of model because we want to control the health outcomes, and like we said, we want to work with the customer in terms of the health journey and not just treating them when they fall sick. So therefore, for us to be able to manage that effectively, we have to work within the network. So for Aditi, that is the model we are working with right now.
In general, where do you think the entire hospital occupancy is moving? Occupancy is not the right way of looking at hospitals. It is not hotels. But let's look at realistically in terms of given that every hotel, every hospital chain has expanded from tier 1 to tier 2, even tier 3, how do you see this entire demand supply equation moving?
Yes. So in terms of occupancy, like we've always said, right now the measures which we are using is midnight occupancy, and more procedures are happening daycare. For us, we do a lot of robotic surgeries, we do a lot of cardiac procedures daycare. So that I think changes the game of how occupancy is measured, and therefore we have to look at throughput of the hospital, the number of patients that they are able to see, with their capacity in a particular quarter. So I think that's a better measure. Definitely, tier 2, tier 3 are so healthcare, if we see, are at multiple levels. There is a level at which uh, people want to access healthcare near to where they live, and there is affluence and affordability coming in tier 2 and tier 3 setups, and therefore setting up healthcare setups in tier 2 and tier 3 allows that affordable population to access healthcare. Then there are centers of excellence for very high intensity procedures or complicated procedures. It is better for people to come to a center of excellence where that entire specialist team, equipment, and capability is. Today, people are migrating from smaller towns to larger cities for both regular work as well as work that happens in centers of excellence. As more and more capacity starts getting created in tier 2 places, I think most of the regular work will start getting covered closer to where people are, and people will move only for centers of excellence for any high-end work.
Okay, so that's a view coming in how occupancies, etc., are panning out. But the other concern that the street has is, and rightly so, is partly that for growth, apart from, of course, the organic growth, inorganic remains a way to do that. And that really means that the return ratios, etc., are going to take a hit. For Narayana itself, could you talk to us about what the expansion plans are, both greenfield, brownfield, as well as inorganic?
Yes. For the past 2 years, we've spent about 1,000 crores each on capex, but a large part of it went into Cayman. Now, this year, most of the work on Cayman is completed, and we've indicated about 1,600 crores of capex. And we continue to maintain that that kind of a trajectory will be our spend. However, our approach has been in terms of order of priority. We are taking a greenfield approach where we are building our capacities, or brownfield where we have existing facilities and we have ability to expand capacity. The reason being that that is the most cost effective way of scaling up capacity. Inorganic is there on the cards for us, but we are looking at the right price point and the right value that we can offer to our customers. And because the market is very hot in terms of the prices of inorganic assets, therefore our business cases are a little different from the probably different players in the market, and therefore inorganic comes lower in our priority list. So what will happen is that over the course of next maybe 3 years, till our capacities of all the investments we are doing are going to come up, we are going to see that our growth are going to be driven by organic throughput improvement, which we have already spoken about within our existing campuses. And that inflection point where the next stage of growth will come for us only when our capacities come online 3 years down the line.
Word on the Mumbai facility specifically, because I understand it made an EBITDA loss in the quarter gone by, and it's been flip-flopping between the profits versus losses. Could you talk to us about when should we expect a sustainable profit figure from the Mumbai facility?
See, the loss is a low single-digit loss, and Q1 is typically a slightly weaker quarter, and especially for children's hospital because of vacations, etc. We are looking to, at a broad level, I think the facility is more or less broken even. We are not compromising on the social side of the infrastructure. So many of the losses or the not being able to break even or grow faster is a conscious call we are making, given that orientation for that facility. So I would guide that you can assume that it's not going to impact our balance sheet or P&L significantly, but it's not going to contribute significantly to our P&L as well in the longer term also.
View as far as the Mumbai facility is concerned. And just before we let you go, I also wanted a better sense regarding the Cayman Island Camana Bay facility. I understand it was inaugurated in July. How's been the pickup so far? I know it's just been one and a half months, but any early indication?
We haven't gone live yet because after the inauguration, there were a lot of statutory approvals that were required. So we are going through those approvals as we speak. So we are hoping to go live next month. I at the moment, from what we are picking up in the market, we are picking up a lot of positivity and vibrancy towards the facility. However, I think we can give a better view. You should give it 6 months because when a facility commissions, you don't really see traction immediately. It takes some time. So 6 months is a good period to take stock of how the facility is doing.
Just one more question regarding that, because I understand, and this is what analysts are telling us, that your hospitals in Cayman, including the existing one, have very high fixed costs. So how much will the new facility impact your margins going forward as well? Because that too is going to come with a higher cost and maybe the operating leverage will not be there. Does that mean that margins in the very near term might take a bit of a hit?
Yes. We have indicated that clearly to the analysts that in the near term, we will see dilution in our Cayman margins because costs will come online and the revenue will come in over a period of time. But what we've also indicated is that because we're running these two facilities as an integrated facility with a lot of shared infrastructure, therefore we wouldn't take that high losses like you take for a typical new greenfield facility. This will be like a brownfield extension of the existing facility, just in a little different location. So we have guided that we are going to be diluting margins in Cayman in the near term, but we will come back again, hopefully over the next couple of years.
It's so good to have you on the show. Thank you for taking the time out and speaking with us today.
Thank you.
Okay, that's the word coming in from the management of Narayana Healthcare. In the meantime,
if you like this video, then like, share and subscribe to ET Now.